The WK-306 healthcare plan is a form that was created because we had several people asking if we had an example healthcare plan. While there is no recommended healthcare plan that I'm aware of through KSDE, this one gives you some basic information to be able to put within your IEP if you do not have one already and you are looking for something for your providers to be able to document a healthcare plan for a student. So this is called WK-306. And if you look at this form, it will automatically fill in the student's name because it's a student form. It has their date of birth, their grade level, and then this information is manually typed in instead of generated from the demographics screen because you may have some students with a legal education decision maker whom does not live with the student, for example, an educational advocate. You wouldn't want their information to pop up here if there was a health emergency. So you have the option to type in parent guardian 1, 2, and their phone number and alternate phone number, as well as an emergency contact and a phone number 1 and 2. So that's why this does not auto-populate here from the demographics screen. The first information box is for the presenting problem or problems. This is pretty open to be able to use the rich text editor to copy and paste from somewhere else, maybe a document from the doctor or something that you've already typed in. It can also be used and you can create it, live as you go. So, or you can draft it before a meeting. So that information can be listed here. Symptoms of what that healthcare plan is addressing. What is the non-urgent treatment or care that the student requires, and what does that look like? So if a student is having a non-emergency or something that is not urgent issue related to that healthcare plan, what does that look like, and what treatment and care should be given? Indications of signs of a medical emergency. This is going to be really important for anyone working with a student. So there's an option, or excuse me, a box available for you to put in information that indicates that there may be a medical emergency based on these signs or symptoms. Again, this form has the rich text editor. So if it's easier for you to use bullet points, you're able to use those. You can also change sizes and fonts and everything else within here, or even include a picture if you have a picture of what a medical emergency for that student, what that may look like. Steps to follow for a medical emergency. Most people are going to list something like call 911 or roll the student on their side of having a seizure or whatever the case is for that student. Here are the steps that we need to have. So again, the rich text editor, you can type it right in there, or it allows you to do, step 1, step 2, step 3, whatever those things are. These boxes are open for you to use however you want to use them. At the bottom, it lists the healthcare provider, the phone number for that doctor, and a hospital preference. So if this form is printed out for anyone, let's say going on a field trip or something like that, that information will be available. Also the date that it was written, the date that staff was trained or provided the information if necessary, and who all has a copy of this. So this is nice to be able to document because each year that you create the healthcare plan or carry that healthcare plan forward, there's a couple extra reminders here. Hey, don't forget to provide that to the transportation staff, let's say, because the student has special transportation or rides the general education bus, whichever it is. So this is the WK-306 form. If you have any questions about this form, feel free to reach out and email us at either Brian or Amber at webkids.org. Have a great day.